Good morning. Great. Well, it's great to be here. For those of you who have been here before, the talk this year is going to be more focused on specific patients that have comorbid medical and mental health problems and what to do, with the hope of it being really practical so that when you go back home, you'll have some new tools. Disclosure, no pharmaceutical, have a long-term relationship with healthcare technology systems that I think has nothing to do with the talk. The first quick question: if somebody has depression, it increases the risk of them getting cardiovascular disease, but by how much? A, 50%, B, 100, C, 150 to 200, D, 300%, and E, no increase. Okay, let's see, what do we got? So it looks like A is winning. We'll redo this again at the end and see if it changes anything. Okay, so the objectives for today are to help diagnose depression in medically ill patients, which, as you know, is not often an easy thing to do, to talk about the bidirectional relationship of medical illness and mental illness, and most importantly, the focus is going to be how to modify treatments based both in terms of medications and psychotherapy for people who have comorbid medical problems. It's often impossible to tell which one came first, and it may or may not matter. Many of these times that the underlying illness, say in terms of immunologic cytokines, may be causing both simultaneously, metabolic syndromes. So the idea is that very frequently patients have long-standing problems with both, and the important part is to work with both. The other key thing is if you have somebody, say, who has significant cancer that might be metastatic, they become depressed, and they have an assumption, well, that means, well, of course, if I had that, I would be depressed. But many people who have that do not get depressed, and often the thing that we can do to help them the most is helping them with their mental illness in addition to the other problems. So you want to avoid attributing everything to the medical illness. But the challenge is that you may have somebody who, say, has cancer, who's getting chemotherapy, and has the symptoms that you see on the left with anorexia, weight loss, lost interest in sex, fatigue, anhedonia, and you'd say, well, is that depression? Well, they technically would meet criteria, but it could all be things related to having cancer and being on chemo. So the key things that you don't tend to see, except with depression, mental illness, are feelings of guilt, worthlessness, and especially suicidal ideation. When you see those things,